Could ADHD drugs be making kids fat? What I'm getting at here is a new study by Florida Atlantic University and Washington University claims that for children who are overweight and using alternative medications for their ADHD, those alternative drugs may be partly to blame if they're dealing with obesity. Dr. Sportelli, parse through the data in terms of typical treatments for ADHD versus these alternative medicines that I didn't even realize are being used so often.
These antipsychotics, guys, are notorious for leading to something called metabolic syndrome, and that's increased blood sugar, increased cholesterol, increased weight gain, and they need really, really close monitoring. The fact here is they should not be used first line for ADHD. And if they are used as an adjunct, the child needs to be monitored really, really closely for these side effects.
Yeah, I think in this study, a third of the children started out overweight, and within 3 months, it was 47%, correct? So a pretty startling jump in terms of the degree of heaviness from these drugs.
It's really incredible what you see. Even in the clinic, you see the kids gain an enormous amount of weight, and that's why these drugs really need to be used with caution.
I would almost argue with these untoward side effects that if your pediatrician is going to recommend one of these alternative medications for that behavior, I would go see a specialist. One of the things that we do know in medicine is that a lot of doctors will see a behavior and they'll treat it with a drug that yes, it may work on that behavior, but then what happens is kids and adults alike, they end up on these medications that have all of these effects metabolically and physiologically.
The other thing that I really want to say is if your child has ADHD and the impulsivity isn't under control and the behavioral issues aren't under control, there are other options. And I want parents to know there's behavioral modification therapy, there's something called parent-child interaction training, there's applied behavioral analysis. These are more psychotherapeutic interventions to get the child to just be better behaviorally, and that is definitely the way to go, at least first, before you jump to a medicine.
I think it's a really important point, though, because I think as people are, the knee-jerk is just to prescribe. I read that the prescriptions of these antipsychotics for ADHD have gone up 600% since the 1990s. Wow. So I think it's really important to point out that you can't just throw pills at these. You have to think about alternate therapies, especially when there's so many side effects.
We've talked enough on this show where a lot of the things we have in our environment can increase the propensity for a child to have these types of behaviors, including the foods that are eaten. Correct me if I'm wrong, Dr. Sportelli. So if your child is eating all the wrong foods, and then they're put on these medications, they're experiencing a double whammy, and you're taking a problem that could potentially be resolved, these impulsive behaviors, and you're potentially creating a lifelong problem of metabolic syndrome and long-term issues with diabetes and heart disease, and that's a really troubling thing. Try everything you possibly can before you go for the quick fix, which is in many cases not a quick fix at all. It's just you're hiding symptoms versus resolving the issues. And I was just going to say, Dr. Sportelli, one of the things I really appreciated about your input on the show is that with all these issues, there's not always a quick fix. And so
there's not a quick fix.
You know, work with specialists, and we thank you for all the work you do with kids out there. Keep up the great work.